Campylobacter is one of our 2 comma or S-shaped organisms. And what is special about the growing temperature? Remember the mnemonic that Campylobacter likes the hot campfire because it grows at 42 degrees Celsius. You should remember that it is a common cause of bloody diarrhea when acquired from undercooked chicken and unpasteurized milk. Also, remember that Campylobacter is one infection that is believed to be responsible for triggering an autoimmune peripheral neuropathy known as Guillain-Barré syndrome. Do you remember what type of paralysis is classic in GBS? I hope you're thinking ascending paralysis. If not, don't worry, this will be covered in depth in the neurology chapter. Our second comma-shaped gram-negative bacteria is vibrio cholera. It can be differentiated from Campylobacter in that it grows in alkaline media, whereas Campylobacter grows at 42 degrees Celsius. If you remember from our basic micro lecture, cholera causes a profuse rice water diarrhea that is mostly a problem in developing countries with poor hygiene. It's usually transmitted by the fecal-oral route, fecal-oral. Once ingested, it must survive the gastric compartment's acidic environment. Keep in mind that anything that would lower the acidic nature of the stomach would allow vibrio cholera to survive. Can you think of any drugs routinely used that might do this? Think about GI drugs like antacids, H2 blockers, and PPIs. You discuss this in further detail in the GI section, but these medications are commonly used to treat GI ulcers. Now, do you remember how the cholera toxin works? You might remember from the basic micro lecture that it is a cyclic AMP inducer, meaning that it activates GS to permanently increase cyclic AMP, which causes excretion of electrolytes and consequently loss of water. Also remember that the cholera toxin works similarly to the E-TEC heat labile toxin. There's a related bacteria called Vibrio parahemolyticus and also another one called Vibrio vulnificus. These often come up on the boards. Now, you can get infected by these from eating raw seafood or drinking seawater. Vibrio parahemolyticus causes diarrhea, whereas Vibrio vulnificus causes either skin infections like cellulitis, fasciitis, and muscle necrosis, or septic shock with hemorrhagic bulla. Question: Vibrio vulnificus is more likely to cause disseminated disease in what type of people? I'm thinking of patients with a disease of a certain organ system. The answer is patients with chronic liver disease. Look out for this association on your exam. Yersinia is a fully zoonotic pathogen, meaning that it mostly infects farm animals and pets. We get infected when we ingest contaminated water or milk from these animals. Yersinia is also interesting because it causes different symptoms based on the affected person's age. In infants or children less than 5 years old, Yersinia causes gastroenteritis with bloody or watery diarrhea. In a child older than 5, it can cause mesenteric adenitis, an inflammation of the mesenteric lymph nodes. The way you might be asked about this is in a daycare child who develops right lower quadrant pain in their abdomen, and they also have some diarrhea. Now, what disease must you also consider if your patient presents with fever and right lower quadrant abdominal pain? The answer is appendicitis. Let's take a quick detour. I can't help myself. Major clinical correlation coming up, and we're taking a roller coaster ride into GI land. You'll get much more of this in the GI section. But appendicitis presents with fever, anorexia, and abdominal pain that classically starts where? The periumbilical area, actually. So here's our patient's abdomen. Here's the umbilicus. And so we're going to have periumbilical pain that's going to migrate to the right lower quadrant. Remember, we're looking at our patient's abdomen. So right is left and left is right. So what diagnostic test might you order? Well, if your patient is a child, you can try to spare them the radiation and get an ultrasound of the right lower quadrant. But for most adults nowadays, we just get a CT scan of the abdomen and pelvis. But what if the patient is a 24-year-old female? Well, you better also consider gynecologic causes of her pain. So what test must you order? A urine pregnancy test. Every female of childbearing age should get a UPreg, a urine pregnancy test when presenting with abdominal pain. Okay, good. So we've got right lower quadrant pain down, mesenteric adenitis, ectopic pregnancy, or pelvic inflammatory disease, and of course appendicitis. What about right upper quadrant pain? So that would be here, right upper quadrant. Let's say a 40-year-old overweight female with fever and constant right upper quadrant pain comes into the emergency department. I'm thinking we might want to rule out acute cholecystitis. What diagnostic test do you want to order? Let's start with an ultrasound of the right upper quadrant. Excellent. She needs a few days of NPO or nothing by mouth, and then IV antibiotics, and maybe have her gallbladder taken out on this admission, or maybe come back and have it taken out later. We want to cover anaerobes in gram-negative rods, so what antibiotic do you want to use? Well, we commonly use piperacillin tazobactam, also known as Zosyn. How about left lower quadrant pain? Let's say a 68-year-old man with a history of constipation who presents with fever and left lower quadrant pain. I'm thinking he might have diverticulitis. What is the difference between diverticulitis and diverticulosis? Diverticulosis is just the outpouching in the colon. What can happen to these outpouchings? They bleed, a very common cause of painless hematochezia or bleeding from the rectum. Okay, so our gentleman with diverticulitis needs antibiotics. Now what do we want to give him? Again, we want to cover him for gram-negatives and anaerobes. So we like to use Cipro and metronidazole. So Cipro and metronidazole, which I'll abbreviate with Metro. If we're going to do oral antibiotics, that's what we'd use. And if we're going to do IV, we'd give him piperacillin and tazobactam. And what is the most common site of diverticulum formation? That would be the sigmoid colon, hence the left lower quadrant pain. Again, I like to take every opportunity to integrate for you guys. There is tons of micro in here. Let's learn it all together with some of the other subjects, and you won't forget it. Okay, back to Yersinia enterocolitica. In adults, it can cause an autoimmune reactive arthritis called Reiter's syndrome. Do you remember the triad of reactive arthritis? Remember the mnemonic: can't see, can't pee, can't climb a tree. They have conjunctivitis, hence they can't see. They have urethritis, hence they can't pee, and arthritis, so they can't climb a tree. Okay, time for another flash quiz. A 57-year-old homeless man is brought in by ambulance after being found unresponsive in an alley. His blood alcohol level is 0.33. For airway protection, he's intubated in the ED and placed on a ventilator. Routine chest x-ray shows a consolidation in the right lower lobe with multiple air fluid levels. What is the likely organism? Okay, so this vignette highlights an alcoholic who has aspirated and developed an abscess. So, what does that AAA make you think of? Maybe somebody saying, ah, and what is the most likely pathogen? That would be Klebsiella pneumoniae, which causes abscesses in alcoholics and diabetics who aspirate. Remember, it has a thick mucoid capsule, which is responsible for the current jelly appearance of the sputum. Helicobacter pylori, or H. pylori, is a gram-negative rod with a corkscrew helical structure, the flagella, that allow it to burrow deep within the mucosal layer of the stomach in an effort to flee the acidic environment of the stomach. H. pylori colonization creates chronic inflammation of the stomach, called gastritis, which irritates the cells of the stomach and results in increased acid production. Stomach and duodenal ulcers are a result of the damage to these organs' protective mechanisms. H. pylori produces the enzyme urease, which cleaves urea to produce ammonia. So our reaction is CN2H4O plus 3H2O goes to CO2 plus NH4OH. This neutralizes stomach acid and allows the organism to survive in the stomach. You may be asked about diagnosing H. pylori with the urea breath test. This test involves a patient swallowing urea labeled with radioactive carbon compounds here. If the patient has H. pylori, its urease will break down the swallowed radioactive urea into carbon dioxide and ammonia. Now remember that carbon dioxide is going to be labeled with our radioactive carbon, and you can simply assay for that carbon in the exhaled air. And this is exactly what you do. The presence of radioactive carbon in exhaled CO2 is actually diagnostic of urease in the stomach. In practice, however, the urea breath test is rarely, if ever, used. Instead, the presence of serum H. pylori antibodies or the H. pylori stool antigen are both commonly tested. Note, though, that once infected, the antibody will be positive, which makes it very difficult to know if the patient is currently infected or was probably infected sometime in the past. I'm sure you will spend a lot more time on this in the GI section, but I want to give you a little glimpse of all the goodness that is in store. H. pylori is most commonly responsible for peptic ulcer disease, which occurs in two major locations, the stomach and the duodenum. Question: which type of ulcer is more commonly associated with H. pylori, gastric or duodenal? The answer is actually duodenal. Hang on, a few more key differences between gastric and duodenal ulcers. Which one is more likely to be malignant? Gastric. You always want to biopsy gastric ulcers. You almost never need to biopsy duodenal ulcers, as they are almost all caused by H. pylori. Okay, great. How about the history the patient gives you? Which type of ulcer is associated with great pain with eating? I'm saying great because the answer is gastric. Gastric has great pain with eating, pain that worsens with eating. And which one is going to be associated with decreased pain with eating? Decreased pain with eating, that's going to be duodenal. Duodenal ulcers are associated with decreased pain with eating. Again, the emphasis there to help you remember. Excellent. Okay, so what are the other two really common causes of gastric ulcers? Well, NSAIDs, like aspirin or ibuprofen, and alcohol. These are the two really common ones. All right, we've talked about some of the microbiological and clinical features of H. pylori infection. Now, how about the treatment? You're going to want to treat with triple therapy. And what are the three components of triple therapy? It generally consists of clarithromycin, amoxicillin, and a PPI like omeprazole. Some regimens can also sub in metronidazole.